Hi everyone, my name's Alistair from Optimail. Today we're going to be looking at how to mix and inject HCG. HCG is a medication used by men and women to promote fertility. It's also used in men alongside TRT to maintain natural testosterone production and testicular size. This is important because it allows men to come off of TRT in the future if they need to. It also maintains other hormonal pathways which help with things such as mood. HCG is injected underneath the skin of the belly fat. This is called a subcutaneous injection. Here we're going to look at how to mix, store and inject HCG. Firstly, we're going to mix the HCG with the bacteriostatic water. So this is your HCG pack. Some bacteriostatic water which we use to mix with the HCG so that it can be stored safely. An alcohol swab for wiping the vial tops and the injection area. This is a 1 milliliter syringe. This is better than a larger syringe as it allows for accurate dosing. And a 25 gauge needle. You can also use a 27 gauge needle. Smaller needles can make it difficult to draw up the solution without bubbles. Firstly, you open this pack up. All you need is this little vial. This contains the white HCG powder and the kind of tablet in the bottom. The rest of this pack can be thrown away. It's only used for women when they're injecting the whole lot in one go. Now you have the HCG vial, we want to inject bacteriostatic water into the vial. This will dissolve the HCG powder in the bottom of this vial here. The amount of bacteriostatic water you mix into the HCG vial will affect the strength of the solution and therefore the amount you need to inject. For our patients, we recommend injecting 2 milliliters of bacteriostatic water. This then means that 0.1 milliliter of the solution equals 250 IUs, or international units, and 0.2 milliliters of the solution equals 500 IUs. So to recap, the total amount of HCG in the vial is 5,000 IUs. So when we mix it with 2 milliliters, that means that each 1 milliliter is half of 5,000 IUs, which equals 2,500 IUs. So therefore, 0.1 milliliter equals 250 IUs, and 0.2 milliliters of the solution equals 500 IU. Firstly, we take the caps off the HCG vial and bacteriostatic water vials. We don't need these anymore, so you can chuck them away. These rubber stoppers allow you to insert the needle so you can draw straight from the vial. Then we take the 1 milliliter syringe. It's important that we keep everything sterile as much as possible when doing this. So to do that, you can leave it in the pack for now to stop the connectors touching anything. Open up the same for the needle. Don't touch the connector on the end. And then you can just put the needle and connector together there. Now we're going to use the alcohol swabs to sterilize the rubber stoppers. We can draw up 1 milliliter of the bacteriostatic water like this. Remember, we're putting in 2 milliliters total, so we need to do this twice. You may have less than 1 milliliter each time. If you do, you can add in the difference after so that you're totaling 2 milliliters in the HCG vial. You can draw it up like this. Now you can insert the needle into the HCG vial and inject the bacteriostatic water. One useful tip is to inject the same amount of air into the vial as the liquid you're about to draw out. So in this case, 1 milliliter. This stops there from being a vacuum in the vial and helps to draw up more quickly. You can also use this trick when drawing up to inject later on. This is the second milliliter, so we will now have 2 milliliters in the HCG vial. Once you've done this, you can dispose of this in the sharps bin. Now we've got our mixed HCG, the next stage is to draw it up so we can inject. There are two different types of needle and syringe. The first type we'll go through is a separate needle and syringe. We're going to use the 25 gauge needle and 1 milliliter syringe to draw up. So you connect the needle to the syringe as we showed before. At this point, if you haven't just sterilized the rubber stopper, you would do this now. Now you draw up your dose. As we have 2 milliliters in here, my dose is 0.2 milliliters, which equals 500 international units. If your dose is 250 international units, then you draw up 0.1 milliliter. We don't want to inject with this needle as it's too big, so we draw some air through, like this, and then switch the needle over to the smaller 30 gauge needle. Remember, we want to keep everything sterile, so don't touch the connector on the end. Discard this needle in the sharps bin. Now you're ready to go. The second type of needle is the fixed needle and syringe. If you're using this type of syringe, you can insert the needle straight into the HCG vial and draw up. You need a new alcohol swab. Swab the area you're about to inject. Take the cap off the needle. Hold the skin around the area, but avoid pinching it. You can now insert the needle just underneath the skin. And slowly push the plunger down. Don't worry if there's a small bubble of air in the needle end. This won't cause any damage with a subcutaneous injection and is often impossible to remove. Now pull the needle out, and you can now get rid of this in the sharps bin. Make sure you also wipe down the area with another alcohol swab. So that's how you mix and inject the HCG. It's important to remember to store the HCG in the fridge once you've mixed it with the bacteriostatic water. You should also store the bacteriostatic water in the fridge. Thanks for watching this video. If you enjoyed it or it was useful, then please like and subscribe. You can also visit our website at www.optimail.co.uk for more information on TRT.